Struggling to catch your breath? Shortness of breath isn't always just asthma or being out of shape. It could be a sign of something more serious. Here's how to tell the difference between chronic causes of shortness of breath. If the patient smokes, has a chronic productive cough, and signs of right heart failure, it could be chronic obstructive pulmonary disease. History of high blood pressure or heart disease? Waking up gasping for air at night? Basal crackles and swollen legs? This could be heart failure. Coughing, wheezing, and breathlessness, especially worse at night, or triggered by cold air. Linked to eczema or hay fever? Think asthma. Shortness of breath, chest pain, and fainting? Listen for an ejection systolic murmur, as this could be aortic stenosis, cancer, recent surgery, or long flights. Sudden breathlessness, pleuritic chest pain, and coughing blood? This could be recurrent pulmonary emboli. Smoker? Unexplained weight loss, chronic cough, or hemoptysis. Could be lung cancer, and you should get it checked early. Gradually getting worse over time? Fine bibasal crackles on examination? Think pulmonary fibrosis. Coughing up large amounts of thick, purulent sputum? History of repeated infections like TB or measles? This sounds like bronchiectasis. Pale skin, fatigue, and a history of stomach problems? It might not be your lungs. It could be anemia. Or if the patient is obese, it could simply be increased effort with activity. If you or someone you know is struggling to breathe, don't ignore the signs, as early diagnosis can save lives. Follow us for more medical insights and share this video to spread awareness.